Thank you, Sue, and good morning, everybody, and good afternoon, and maybe good evening. It depends where you are in the world. So thank you very much for giving me this opportunity to speak. So as Sue said, this morning I'm going to share the results of our water immersion study with you, which was conducted in the Coombe Hospital in Dublin, and it is the first water immersion study to be conducted in the Republic of Ireland. So we're very, very proud. Apologies, everybody. These things happen.
Well done, Paula.
Thank you. So as Sue said, we published our study in the BMJ Open in December, just 2 months ago. So we're absolutely delighted to be here today. So first of all, I just want to give you some background, I guess, to water immersion. And background to water immersion. So the historical context, well, I don't have enough time to tell you, but it's safe to say that water birth and water immersion has been carried out for centuries in various countries around the world. In more recent times, Dr. Michel Audant, French obstetrician, he published about the first 100 water births in The Lancet back in 1983. And since then, across Europe and particularly in the UK, water immersion has become integrated into maternity care. And almost 20% of women use birthing pools in the UK. And of them, almost 5 to 10% of babies are actually born in water. So that's a lot of babies. Anything between 32 and 64,000 babies a year in 2019 were born in water. Water birth expert Diane Garland, she states that approximately 119 countries worldwide offer the option of water birth to women. And closer to home then, in the Republic of Ireland, in 2004, Cavan and Drogheda, as part of their MLU service, offered the option of water immersion for women. And then in recent times, Cork, ourselves in the Coombe, Limerick, Wexford and the National Maternity Hospital have also introduced pools. So 7 out of the 19 maternity units in Ireland have pools at the moment. Also now it's become national policy. We have our National Maternity Strategy, which Margaret alluded to this morning, and that's very much about normalising birth and increasing options for women, and water immersion would be one of these options. So why use water? So the evidence. So the benefits, and always remember, these are low-risk pregnant women, healthy pregnant women and healthy babies. So for women, we know that it increases pain relief. So it's actually a natural form of pain relief. Increases women's mobility, aids gravity, adopt upright positions, and all of this shortens labour. Increases normal birth, and also higher satisfaction rates among service users, women that use water. For the babies, we talk about a gentle birth. So the baby's very much hands-off birth, baby's born into warm water. The mum, with the assistance of the midwife, lifts the baby up and out gently to the surface of the water. So it's a gentle, non-intervention birth. It promotes skin-to-skin contact, deferred cord clamping, and breastfeeding. For the midwife, who is the expert in normality, it really helps us promote and protect women, protect physiological birth, as I said, non-intervention birth. And it's a way that we can guard these women and use all of our midwifery skills. We're the expert in normality, and this really helps us do that. And for the organisation, obviously it gives women options. It attracts service users, also attracts midwives, which is very important, particularly in the Dublin maternity hospitals now. We have issues with staff recruitment and retention, so we know it attracts midwives. Potentially cost effective. If you have less pain, you're going to need less epidurals, and potentially then it can be a cost saving as well. And for obvious reasons, as I said, implementing national policy in Ireland. So we really need to promote the use of water in Ireland. So evidence, yes, I'm going to continue on now. So talking about the evidence about water immersion and safety. So we know that labouring in water is well proven. And even the most conservative critics of the use of water will accept that and say, okay, we know it benefits women. However, for water birth, there's less evidence out there, but there is evidence. Okay, so we've RCTs, Cochrane reviews, case control studies, retrospective reviews, prospective, numerous reports, reviews from water birth experts, UK, across Europe, Australia, America, and obviously the RCM and the RCOG and NICE. So there's lots written about water birth, even though sometimes we feel there's not, there is. And then this is how people say to me, how would you summarise the safety, Paula, about water birth? And this is how I summarise it, these three good quotes I found from the literature after being immersed in 8 years, excuse the pun, in water literature. So potential risks associated with water birth for low-risk women and neonates appear minimal, and the outcomes comparable to those in any healthy childbearing population. That's Nutter et al. 2014. Water birth is a reasonable option for low-risk women, provided they understand the potential benefits and risks. Women are happy and midwives are confident. Although more research is needed, currently there's no evidence to deny women this option of pain relief, and that's Decker 2018. And then more recently, Snap et al. 2020, water immersion for labour and birth is a driver for improved birth experiences, empowerment of women, and as safe as land for low-risk women. And that's how I summarise the evidence regarding water birth. So the Coombs story then, our hospital, and what led us to our study. So in 2011, we commenced a domino, midwifery-led model of care. And obviously with this midwifery-led model of care, because these women, they hope to have and opt for a more physiological labour and birth, we needed something for them. And that's why we installed a birthing pool. And we renovated, we were very lucky in 2012, we got some funding, we renovated our labour ward and we were able to install a pool. In 2013, we commenced water immersion for labour only. And in 2014, we had our first water birth. And in 2015, we had 230 women had used the pool, and 62 of these had water births. However, in September of 2015, a multidisciplinary meeting was called because there were some concerns. And one of the concerns was about the OASI rates, which is a 3rd and 4th degree tear, so severe perineal trauma. And obviously as well, we were all concerned about that. So there was clinical governance issues and there was issues around resources as well. So just with the OASI, what we found was that at the time, the OASI rate in the hospital, in the Coombs Hospital in general, was approximately 2.2%. But for some reason, in these 62 water birth women, it was 8%. So it was high, okay? And we were concerned. We reviewed everything. We reviewed the women, the midwives. We looked at the literature. I spoke to several water birth experts, and we couldn't work out why we were having these tears in the pool. And ultimately, we wondered, was it because in the Coombs we're very used to, which I'm sure a lot of you are in your own hospitals, used to hand-on births, so visualising the perineum and hands on the perineum and guiding the woman with coached pushing. Whereas in the pool, for obvious reasons, you don't do that. So we wondered, was it that it was a new birth technique? It was new, it was teething problems. And ultimately we said, look, was it just bad luck? Because you cannot come to a scientific conclusion with only 62 water births. So we really felt that, as did our team and our consultant body. However, we were concerned, and we were concerned enough that they recommended that we commence our own study in the Coombs Hospital and review the OASI results and levels ourselves. So we did commence our study in 2016, it took 3 years. And so water birth was still provided, the service was provided under the remit of the research study. In 2019, as I say, we completed and we analysed, and then in 2020, we published in the BMJ Open. So that's our story, our 8 years of a story. So our study then. So our study design, we had 380 participants. And as I said initially, these are low-risk women, 380. 190 in the water immersion cohort, and 190 controls. So these were low-risk women that came in labour and did not want to use the birthing pool. So out of the water immersion, we had 100 water births and we had 90 women who laboured in the pool and exited for the birth. And then we compared them, as I say, between the 190 women that received standard care, which we call is care that they laboured and they birthed on a bed, so standard care. Our analysis then, we used SPSS version 25 and we did some descriptive analysis comparing water immersion versus standard care. We measured the association between water immersion versus the controls and water birth versus water labour. We also measured the association between water immersion and labour events, and water immersion and birth outcomes. And we adjusted there for some variables such as maternal age, BMI, women's occupations, etc. We did a nice subgroup analysis in relation to nulliparity, which is important, and our results are reported as ORs and 95% confidence intervals. And we also looked at women's experiences. They were captured via childbirth experience questionnaire, a validated questionnaire from Sweden. So we included a qualitative aspect as well. So some results then. So characteristics of women who used water immersion and their controls. So just on this slide to explain it briefly, the blue pillar is the water immersion cohort and the orange are the controls. And I am presenting the results there in percentages. So nulliparous women, first-time mums, just over 55%. Maternal age, yes, significantly more women who used the water. They were older, in the older age bracket, professional, married. They were less likely to smoke or to be overweight, and they were more likely to attend a midwife for antenatal care and to attend antenatal classes. So some results then are labour and birth outcomes, water immersion versus controls. So you can see from this slide, the controls were significantly more likely to have an epidural and to have an operative vaginal birth. There were more SVDs in the water immersion cohort, and the water immersion cohort had longer third stage of labour, 15.8 versus 1.6. And were more likely to have physiological third stage of labour, which you would expect really with women that use water or give birth in pools. And the BMI, interestingly, the women that use the water appear to have higher birth weight babies, so slightly larger babies. And we wonder, was that because maybe they had healthier lifestyle choices with regard to BMI, diet and smoking? So birth outcomes for water immersion versus controls. So as you can see, perineal suturing, similar, no difference between the two cohorts. OASI rate, no significant difference between the water immersion and the control. PPH rate of 500 mils or more. There was a higher rate among the water immersion cohort, as you can see, 10.5 versus 3.7 in the control cohort. It's just important to remember that this group were the water immersion women. So they included the 100 water births, but also the 90 women that exited for birth. So those women may have exited because they requested for an epidural or maybe failure to advance and needed syntocinon and an operative vaginal birth. So it's just important to remember that. Also, the PPH rate of 1,000 mils or more, there was no significant difference between both cohorts. HDU admissions, 2.6% of the water immersion cohort spent up to 24 hours in our high dependency unit, and no women in the control group were in the HDU. NICU admissions, no significant difference between the babies in both groups. And as you can see, breastfeeding, initiation and exclusively breastfeeding on discharge were significantly higher in the women who used water versus the control cohort. Just to continue on then, the labour and birth outcomes for water birth versus water labour. So perineal suturing, so the women in the water birth cohort required less suturing than women that laboured in the pool and exited for birth. The OASI rate, no significant difference between water birth or water labour. PPH, less rate of PPH in women who had a water birth versus women who laboured in the pool only. And PPH rate of greater than 1,000 mils, no significant difference there. HDU admission rates, no significant difference between water birth or water labour. And similarly with the babies, NICU, no difference there with the babies needing to go to the unit. And breastfeeding initiation rates were high in both water birth and water labour groups. However, they were significantly higher on discharge. Those women that had a water birth were more likely to be breastfeeding. So then the nulliparous group, so some labour and birth outcomes, water immersion versus control. So as you can see from this slide, the nulliparous women that did not use the water, well, they were significantly more likely to need an epidural, 62% versus 24.8% of women that used water. The SVD rate was higher among women who used water versus the control. And that's really important as well to remember, because I'm not sure about your countries around the world, but we have a high C-section rate now among our prima gravida women. And so it's really important to mind these nullips and try our best safely to achieve vaginal births. Also perineal suturing, less among the water immersion group. OASI, no significant difference between water immersion versus control. PPH, as you can see there, was higher among the water immersion cohort, but just to qualify that by saying this includes the women who exited the pool and may have ended up with an instrumental birth. So it's skewed the results slightly. PPH rate of 1,000 mils or more, no difference. HDU rates, 2 women in the water immersion cohort went to the high dependency unit, and no nulliparous women from the control. And NICU, no significant difference with babies there needing NICU admissions. And breastfeeding rates a lot higher with women in the water immersion cohort on discharge. Again, really important that we make sure that these women are breastfeeding, and particularly nulliparous women, because if they do well and they breastfeed, well, hopefully they'll breastfeed their next baby. Results, labour and birth outcomes for nulliparous women in water. So just a reminder that this is quite a small cohort. So the water birth women was 39 and the water labour 66. So perineal suturing, the dark blue pillar there is the water birth women. So less women needed perineal suturing compared to the water labour. OASI rate, yes, this might look a little bit alarming when you see 7.7 versus 1.7. However, as I said, our numbers were small, and that's actually 3 women versus 1 woman. So 3 women in the water birth group versus 1 in the water labour. PPH rate, no significant difference, 12.8 versus 16.7. PPH rate of 1,000 mils and more, no significant difference either. HDU, none of our nullips from the water birth cohort spent time in the HDU. 2 women who laboured in water did end up in the unit in the HDU. And NICU admission, so the babies requiring NICU care, 7.7 and 3. And again, that actually was 3 babies and 2, so small numbers. And exclusively breastfeeding on discharge, high rates, as you can see from the breastfeeders there, or from the water birthers, nearly 72% versus 56% of the water labourers. So overall, the breastfeeding rates were very good among the water birthers. Then, as I said, we also included a qualitative aspect in our study, which is really, really important. And I would recommend this if you're doing a study, to have both quantitative and qualitative. So we examined women's experiences. Every woman was asked to complete a questionnaire consisting of 21 questions or statements. And we explored 4 domains in particular. So their sense of their own capacity, professional support in labour, perceived safety, and their level of participation or engagement during their labour and birth experience. And as you can see from this slide, overall, the water immersion women scored higher regarding their satisfaction rates. So significantly higher, as a matter of fact. They felt very capable, much stronger. They felt they had a say in their birth experience and their birth position, felt secure, and they felt less pain. And overall, they had more positive memories of their birth and less negative memories. And this is really important. We know now with post-traumatic stress and postnatal depression, there's so much done. And I know Maeve will be speaking about trauma and fear of childbirth in a few moments. And so it's really important that women feel empowered and have a satisfactory birth experience. So strengths and limitations. So it was a prospective design. We had a clearly defined inclusion criteria. We had appropriate comparison group. We included both quantitative and qualitative methodology. And I suppose really our research framework, it supported organisational change, and it also allowed us to provide a water immersion and a water birth service for women under the remit of a research study. And the numbers are small. I wish it was a larger study. However, I would say after reading all of the literature that our findings are reflective of many, many larger studies that have been carried out worldwide regarding water immersion and water birth. So in conclusion, women choosing water immersion for labour or birth, well, they were no more likely to experience adverse birth outcomes than women receiving standard care, and they rated their birth experiences more highly than women receiving standard care. I just want to acknowledge the fantastic participants, the amazing women, brilliant midwives on our labour ward, my research team, the COOM management and the Board of Management, and the NMPDU for funding, which enabled me to be the research midwife on the project. And my references, and thank you very much for listening. And sorry for the technical hitches along the way. Thank you.
Thank you, Paula. That was fabulous. Such an interesting study. And I think because of the way we're ahead of ourselves, I think it might be, if it's okay with you, if we can fire some questions at you.
Yeah, no problem.
Fabulous, because then we've got even more for Maeve at the end too. So this works out very well. I've got a question from Neve Cassidy. Hi, Neve. I hope I've pronounced your name correctly. When do you think we'll see water birth back in the community?
I would say very soon, Neve. We are going to linking in with the powers that be, and this is our aim this year, that we absolutely need to get this back on the agenda again. As I say, our study isn't going to change the world. It's a small study, however, it is reflective of all of the other international literature. And as I say, there's no difference. We're talking low risk women and midwives that are happy to provide this model of care. And I actually think at this stage it's unethical that all of our units are not providing this service. When I see the outcomes and see how happy the women are, to me it's unethical that we're not doing it. And so, Niamh, my answer is very soon. And this definitely is going to be part of my agenda as well, moving forward.
Fantastic. I think that's beautifully put, Paula. Fantastic. I've got a question from Diane. That's Diane Garland. Hi, Diane.
Hi, Diane.
And she says, did the control group have SVD, or were some instrumental deliveries?
Oh, yeah.
Or SVB? I think.
There were nearly 24% of the controls were instrumental births, Diane. Yes, they were. Yes.
Which is quite high, isn't it?
Absolutely. Yeah. Yeah, and I would think, as you can see, Diane and Sue as well, that the epidural rate was very high, you see. And it's very hard, particularly on prime-ups, to cope with no pain relief. And that's why the water gives them the option. They definitely cope better, and there's less need for epidurals as well.
Yeah, I think this is going to seep very well into Maeve's session, actually. I can
Absolutely.
see kind of the idea of being control. And I think your qualitative element was really interesting from the point of view of women feeling in control and more empowered and kind of happy with their experience. Fantastic.
And I think it's funny as well, Sue, because some people think we give the women an epidural and they feel more in control because they have less pain, so they're in control. But it's actually, if you turn that on its head and say no, often they feel, oh my God, I have no control because I'm numb from the waist down and I don't know when to push, and I feel I'm actually kind of out of control here. Whereas you find the women in the pool, the pain never goes away in water, but it really helps them, and they feel, God, actually I feel quite in control here, even though I feel the pain, you know. So it's just turning it on its head and looking at it that way instead, you know.
And I wonder if you get the interaction from the midwife, because if you're in water, there's a different kind of, and we talked a little bit earlier, I think Linda mentioned about relationship. And I think you can get a different relationship because the environment's so different. You're less a technocrat as a midwife and more connected. But that might be a subject for another piece of research, I guess. Anyway,
and I have captured all of those as well from the midwives. That's my next paper.
Oh, wonderful. Yeah. But we'll look forward to hearing that bit of information. That'd be really interesting. We've got a question from Lola. Hi, Lola. And she says, hi, Paula. What are your thoughts on women who fall just outside the normal BMI and are otherwise fit and well, but would like to have a water birth or use water in labour? And that's a fantastic question, because that's such an issue for women at the moment, isn't it? Especially after lockdown and all this baking.
Yeah, totally, Lola. Thanks a million. For our study, just because it was the research study, we kept it really low risk. So the BMI, we kept it with 30 was the max for a BMI of 30. So we do plan now to increase it to 35 moving forward. And it's because, as Lola said there are that cohort of women between the BMI even of 30 and 35 that could be ideal for the pool. And I feel, you know, we don't give them that option, but yet we put them on a bed and give them an epidural and give them syntocinon, instead of saying maybe these women could be better mobile and weightless and get into good positions. And once they're mobile, if they can get into the pool, they can get out. You know, so it's a good demonstrate mobility. And so I really believe that we've over-medicalized women who have a higher BMI, and maybe that's why we're seeing then, oh, they're bleeding and they have problems, if they don't labour well. It's because we're not giving them a chance to labour well, or trying to treat them, prevent problems and keep them a little bit more normal until there is a problem. Yeah. So I really got, like Lola, I feel that now as well. Get the women up and out. And some units, I don't know where Lola's from, some units in Northern Ireland and the UK, the BMI is actually up to 40 and they have the women in water. So we were very conservative. So I think 35 were definitely...
30 to 35 is kind of considered obese or overweight.
It is, yeah. Exactly. So, yeah, you know.
But you can be perfectly fit.
See, I think as well, so some people are anxious that if a woman collapses in the pool and her BMI is 35, and I understand people are concerned about that, but we do our drills. And also, I mean, when you ring the emergency bell in our labour ward, people come. And also, you know what? How many of these women actually do collapse in the pool? So far, we've had nobody, thank God.
Touch wood.
You know, the low risk women, get them. And if you're always anticipating a problem, you're going to get them out. As Diane Garland, who will be on later on, Diane always says, if in doubt, get them out. Be sensible. You know?
Fabulous. Fabulous. Thank you. Okay, next one. We've got another question. Tracy Donegan. Have any COOM obstetricians attended a water birth?
Thanks, Tracy. Yes, they have. Yes, a few have. I wish more had, but I feel now that we're going to recommence our water birth service in March. So we've proved it, we've done our study, and the service will have to be rolled out now, and that's it. So, and some of our women are obviously attend privately in Ireland. So if women are looking for this model of care, well, women are going to march with their feet. That's
absolutely,
it.
absolutely. I mean, it sort of calls into the issue of training, because I think in the past it always was a bit, midwives might feel uncomfortable if they hadn't been trained or they didn't know what to expect. I mean, like you were describing the drill of getting a woman out of the water birth in a hurry. If you've got that training and you know, that confidence is enormous, and then you're more likely to offer the service, aren't you?
Exactly. So yeah, I agree.
Okay.
I agree.
Okay, I've got a lovely, now someone said fantastic, Kiara Carvin, hi Kiara, said fantastic study. I hope we see big changes in maternity services soon and give women more choice. Well done. That's not a comment.
Thanks.
That's a comment rather than a question. And then Catriona Faculty says, good morning, I'm an incoming student midwife and look forward to learning more about water birth. Thank you for a very informative session, and I look forward to seeing the pool in action in the Coombe during training, hopefully. Well done, Catriona. I'm sure you will. I think Paula's a very determined person. And then Anne Glover says, what is the ratio of pools available, and are women aware that water birth is an option? And I'm not sure if Anne's talking about the Coombe or all of the units that are covered.
So, and in Ireland, the Republic of Ireland at the moment, we have 19 maternity units, and of them 7 have pools.
7,
but only 2 provide the water birth service, you see. So that's ourselves and Wexford at the moment. So other units have pools, but they don't provide the water birth service. But this is something that's going to have to be looked at now, and I think for a few years, people were saying, oh, we'll wait for the result of the Coombe study. But now it's here, it's published. So, we need to support. And in fairness, every day I'm getting emails from other units asking where do we get our pool, how do we get it? And we've shared our guideline, we've shared everything with all of the other units.
Fabulous.
So we need to move nationally on this, I think, and have a big. I was saying during the weekend, I was talking at a meeting, and I said I think we need a national database which will make it much stronger, because Sue, at the minute it's very hard because we have 100 and maybe Wexford have 10 births and someone else has 5. If we pool them all together, we have bigger numbers, and then we can prove and state our case, and that's what we're going to have to do, and that's what they did in America.
That's grand. Thank you, Paula. Okay, we've still got a few questions coming in. Margaret Richardson. Paula, did you consider including infection rates in both groups? If not, why not? Great presentation.
Yeah, to be honest, I have all that on my database, and there was nothing to report. That's why I haven't, because really, if it was, particularly with the little babies, it would be the NICU admissions, and there was no issue. Our NICU admissions were the same as a regular group in the Coombe. Our Coombe rate for 2019 was 4.4%. of babies are admitted, and it was the same with our study. So I didn't need to talk about it, to be honest.
Excellent. Well, we only gave you a short session anyway. Okay, and Sheila O'Sullivan says, is this a particular problem in Ireland? Our unit in Cheshire has almost 11% water birth this year. Oh.
No,
I bet there's people who be watching, be very envious, Sheila.
Yeah, great. Yeah. And I think a lot of it, Sheila, is fear as well, because it's relatively new in the Republic of Ireland. It was fear that, what's going to happen to these babies, and will the women have loads of tears? And as I said during the presentation, we were so used to this hands-on birth in the Coombe that all of a sudden they were in water, and we felt we're not really in control of this. But it's just a different. It's almost like you're changing our mindset. Instead of the directed pushing, it's nearly no, breathe. It's less of the directed pushing, and obviously watching, and any problems, as I say, you're going to ask the woman to come out.
I always think of it's more the eyes and the voice rather than the hands on this.
Totally.
And then we have a comment from Nikki, who says, great presentation, long awaited. Well done, Paula, for hanging in there. Was there much interest from medics having such good results?
Yeah,
that's a good question.
Yeah, no, there was, Nikki, and got lots of comments, lots of positive emails, and a lot of it was, like you just said, it's perseverance. I'd say, to be honest, people probably thought we'd just go away. And when we had that multidisciplinary meeting, I'd love to tell you all the story, but it was a 4.5-hour meeting on the 30th of September 2015. And my heart broke because we were told we can't do water births anymore unless we do a study. And I said, how are we going to do a study in the little old Coombe? And how will I, compared to lovely Diane Garland and Ethel Burns, all these amazing water birth people, I said, we can't compare with them. But we did it. And I think a lot of people thought maybe they'll just go away and give up, but we didn't. And we've published, so so it's worth it. You persevere. Yeah.
I think there's been lots of people have been saying congratulations. Sinead Thompson also says congratulations. And I think,
thanks, Sinead.
Paula, this has been a fantastic session because I think you've illustrated the grit and determination that midwives can have.
They do.
To get on with it, and the importance of evidence and using evidence. And I think you've just summed it beautifully up. And I'm sure that the 7 in 19 water births is going to increase to 19 in 19. And those are going to become water birth, not just water immersion, which is,
totally.
Water immersion is always a choice because some women change their minds. But given a choice, and many women would stay in the water and don't want to get out. So I think you've demonstrated that study so brilliantly, and we look forward to hearing the next chapter in this story. So thank you so much for coming this morning to share your research with us.